Okay, I'm back. Don't worry, I got more than 8 hours of sleep last night, and if I start earlier today, then I can end earlier. But yesterday I had a toddler, a small patient, a child. I don't know why I said that. That came in with ear infection or otitis media, and the mom asked if she could see the ear infection or see what I was looking at. And I don't know why that stuck with me. Parents have never asked to see it, at least with me. So I thought it would be cool if I showed you what it looked like. First, ear infections most commonly occur between 6 months and 2 years old. And I always tell this, especially to new parents, they're not from anything that you were doing wrong. It's usually just a consequence of anatomy. The ear can get relatively complicated, so I just wanted to start with some basic anatomy so that we're all starting on the same level playing field. You have your inner ear, which is composed of a lot of important structures that help us with hearing. And then you have your eustachian tube. This is really important on the subject of ear infections because this is the tube that drains the inner ear. This tube drains from the inner ear into the back of the throat. 1 second. I'm not working yet, so I start in 5 minutes. The eustachian tube helps to drain the inner ear, and if it can't properly drain, then there can be an increase of fluid, which can increase the risk of ear infections. And the reason why this is important for children is because of just simple anatomy. Their eustachian tubes are often not as open as they should be, and that can increase the risk of fluid accumulation. Oftentimes also the eustachian tube can be shaped a little bit differently as children have smaller necks and haven't yet grown into their adult size. So when we look inside the ear, we're going to be looking at the eardrum or the tympanic membrane. Tympanic has origins of drum. That's just a fun fact. So this is a normal eardrum. As you can see inside the ear, it looks relatively clear. You can see light reflecting off of it. This is a normal exam. Quick tip, when I'm examining a child, they're usually terrified of the otoscope or the tool that we use to look in the ear. So oftentimes I'll take the otoscope and look in mom or dad's ear, then I'll look at something that does not related at all, like the kneecap or something, and then I'll slowly move up to the ear. That trick works for me. I don't know how, I can't edit this photo, but this is what an infected ear looks like. As you can see, the eardrum is bulging out. There is fluid behind it. The light reflex that you normally see is not as obvious, and so these are signs that the child has an active infection. According to the American Academy of Pediatrics, not every child needs antibiotics immediately. It depends on the severity of their condition. If a child is in extreme pain or has a high fever, or if both ears are infected, or if they have a higher risk in general, then antibiotics are usually indicated. But if the symptoms are very mild, then you can hold on antibiotics and quickly observe. But I just think it's cool to see what it looks like.